Hi everybody, running through water. Happy Monday. So I'm back again because the Senate has not voted on that health care bill. And I'm here to remind you we still have time because they have postponed voting on the bill for a number of reasons. The new draft came out again on Thursday and it's still a complete atrocity to Medicaid. So I'm here to tell you again, even if you don't have Medicaid, even if you don't think you ever need Medicaid, I'm going to tell you how slashing Medicaid is going to affect you. Years ago, I worked in a nursing home and I did admissions work, and I would get a call every day for a while from one of the local hospitals who had a John Doe in their inpatient, I believe he was in ICU. He had a ventilator. He had what's called TPN. He had all of his nutrition intravenously. Round-the-clock care, bed sores, just very, very expensive patient because they could not identify him, and he had no family to speak of that they knew about. They essentially had to eat the cost of this patient, who was easily costing them $10,000 a day, if not more. So I'd get a call every day with them trying to place him in our facility. We were a privately owned facility. We weren't going to take somebody who didn't have a payer source. So here's the thing. He didn't have a payer source, but he was really sick and he was in the hospital. Who do you think covered that? Well, it was the hospital. They had to absorb the cost. And I'm sure they got to write a whole lot of that off. But here's how it comes out. It comes out in higher costs when you're in the hospital. It comes out in lower staffing. It comes out in less maintenance people, less housekeeping people. So that means when you are sick or somebody you love is sick and they go to the hospital, if the hospital is eating a lot of costs, because when you don't have insurance, typically use the emergency room as your primary care because it will get written off. And we're all going to pay for it anyway, guys. So if Medicaid goes away, we go back to that. If universal health care, even as it is, goes away, we go back to that. This was a way to cut costs universally. I did something that I have never done before. I went down to the senator's office. He's on the fence. He's one of the few GOP who are just on the fence on this bill. And I went down not as an advocate or a social justice warrior or a social worker or even a disability advocate. I went down as a mother of a disabled child, and I went down as the daughter of aging parents to remind them that when these cuts and caps for Medicaid will come right at a time that I'm going to be a little too old to keep working. My health is not going to get better than it is today, and I'm going to have a disabled adult and two elderly parents who probably can't afford $50,000 a year out of their own pocket to a nursing home for very long. So guys, it affects us all. Unless you don't plan on getting old or sick, or you don't plan on your parents having any kind of extended illness themselves, slashing and burning Medicaid is not our answer because it's going to affect us all. So thanks. Have a great day, guys. Go call your senators. We still have time. 3 minutes in the water.